I think we in pediatric oncology talk a lot about relapse, we talk a lot about refractory disease, and that's often very difficult for everybody to understand exactly what that means. In our world, refractory means that patients aren't responding as well as we want them to the upfront therapy or to the therapy that they're getting. Whereas relapse disease is the disease has gone away and then something new has come back. Both of those, especially early on at the time of either diagnosis of refractory disease or relapse disease, are treated pretty similarly. So I think a diagnosis of relapse is always devastating for anyone. A lot of times families have an inkling that something's going on and so are almost expecting it, but it's still next to their day of diagnosis, probably one of the worst days of their life. I think it's important to be honest and talk through kind of what our expectations are, what our goals are with relapse therapy. Some of the advances that we've made over the past 10 years have really been the combination of chemotherapy and immunotherapy or antibody therapy. And that has proven widely successful in a lot of our patients and really gives us that hope and that goal that we're looking for of trying to stabilize or even improve the amount of disease that they have.
There are a lot of options of therapy that the provider and the family together can choose for the patient. This is where clinical trials become a little bit different as opposed to upfront therapy where there's phase 3 studies that patients are getting regimens that have been studied for a lot longer. This is a different scenario where there are phase 1 and phase 2 trials that their child may or may not be eligible for. So as a provider and as a care team, we sit down with the patient's family and really go through every single open trial that their child may or may not be eligible for so that the family can see, oh, my child could have gone on this trial, but this is this one little thing that won't allow them to be on this trial, so that they can understand, especially if they have an outside family member saying, your child needs to be on this, that their child actually can't be on that trial. And then going through the rest of them and saying, what would this look like for your family? Would this be uprooting you from your home state and making you fly 8 states away and living there for 8 months and leaving your other children behind? Or the next one, what would this look like for you if you had to travel back and forth for 5 months at a time? There's so many different variables that go into choosing the best option at relapse for that family. The goals become different for each family, but there's still so much hope.
Now we actually have some long-term survivors, and that's pretty exciting. And I think even if we can't achieve that goal of long-term survival, through all the research that's being done and kind of all the new treatments, there are lots and lots and lots of really good treatment options that we now have to help take their pain away and help make sure that they have some really good quality of life and quality years left ahead of them.